Okay, so let's talk about another problem that can affect women, which is vaginismus. Luckily, this is a fairly rare disorder where painful involuntary contractions of the lower one-third of the vagina make penetration either very difficult or impossible. So a woman who wants to engage in coitus, or it's usually coitus that's prevented, but sometimes it can also be penetration by fingers or other objects that she wants to have happen are prevented from penetrating or become very painful because it's like a cramping of the lower one-third of the vagina, and that causes the muscles to become completely rigid. It's completely involuntary, and she can't prevent it. She doesn't do it on purpose, and she can't make it not happen. Now, I got this off of vaginismus.com, and they have this cycle of pain flow chart that shows you this. It starts with the anticipation that penetration is probably going to hurt. And it might be because of previous things that happened to the woman. Sometimes sufferers have been the victims of childhood sexual abuse or rape in the past, but a lot of times not. Sometimes it's just they think maybe they've heard horror stories about what coitus feels like the first time or something, and so they have anticipated pain, and that causes this involuntary reaction, and then that causes sex to actually hurt or makes it impossible because of the pain that's involved, and then that just reinforces the belief that it's going to hurt. And so then the woman starts to engage in bracing, like anytime that there's sex on the horizon, she starts tensing up, and then she may just start to avoid any situations that could lead to sex, start sort of rebuffing her partner, things like that. And it's just this cycle where it sort of just builds on itself. What causes this? Well, psychologically, could be depression or anxiety. I mean, it sounded like that circle was all about anxiety, didn't it? But also depression, relationship problems, like I mentioned, possibly prior sexual abuse of one sort or another. Maybe she's so inhibited about having sex in this context. It could be premarital sex. It could be sex when we're not planning on having children or something like that. And it feels like it's a violation of things that she holds near and dear, or that she thinks other people would judge her for, that might cause this reaction. And then, of course, being scared she might get pregnant would cause her also to clamp up. Stress can cause that. And so this involuntary reaction might be a function of psychological factors. Could be biological also. After giving birth, a lot of times women have this kind of response because after giving birth, the first time that they have sex again, they might still have healing sutures in the vaginal area. After when a baby's born, sometimes the vagina tears, the opening of the vagina tears, or needs to be cut, and then there are stitches placed there. And you know, when you have a scar, it can hurt when you touch it initially. So childbirth can cause painful areas that then start that fear that it's going to hurt. Low estrogen can cause a lack of lubrication that makes sex painful. Interestingly, giving birth causes a drop in estrogen, which then can cause vaginal dryness. So even if the woman didn't have an episiotomy or a scar, she is probably experiencing low estrogen, especially if she's breastfeeding. And so that can cause vaginal dryness. Of course, there are treatments for that, right? Certain infections, vaginismus, yeast infections can cause pain. And so the next time you go to have sex again, even if the infection's cleared up, you might have this expectation. So urinary tract infections can cause pain, yeast infections, bacterial vaginosis can cause pain. Now, even if you have adequate estrogen, you might still have inadequate lubrication for this circumstance. And so, again, we're back to lubrication. Pelvic trauma, sometimes it happens through childbirth, maybe it happens through some kind of accident that can cause pain. So, what do we do? Well, psychologically, guided masturbation can be really helpful for a woman who's like not very experienced and is just really, really worried about what's going to happen and doesn't understand how her body's designed and stuff like that. So getting familiar with the body through guided masturbation, through use of a mirror, things like that, maybe even just textbook pictures can help. Sensate focus so that you don't have as much performance anxiety and pressure, and then couples therapy to help get through whatever anxiety might be contributing to this. Biologically, again, guided masturbation will help with the familiarization with the body. Kegel exercises so that you can learn to control those muscles on purpose and relax them maybe on purpose. Lubricant for the low estrogen or the lack of lack of lubricant. And then doctors invented these dilators that are pictured here. They're in white on the side of this. It's kind of hard to see them in the picture, but if you look closely. And the idea is you start with the smallest one and work your way up to the biggest one that more closely approximates a penis. And your vagina is supposed to, you're supposed to mentally teach your vagina sort of physically what it feels like not to clench up, and that it's not going to hurt you and that you're going to be okay. Some women with vaginismus completely cannot believe that these things even exist, and it's like an insult. And in fact, in the olden days, the dilators would be used by the actual doctor on a patient who's got her feet in the stirrups. And women were like, this is 10 million times worse than anything I was ever thinking about. So now they send them home with you. You can order this off of vaginismus.com and do it yourself if you want. And they have the DVD to show you how to do it without it being painful or scary and stuff like that. You have more control, so that if you do use the dilators, that sense of control is supposed to make it a little less traumatic than going to the doctor and having it done to you. So some biological and psychological treatments for that. Now there are some problems that affect both men and women. Hypoactive sexual desire has become more and more common over time. Sometimes we call it inhibited sexual desire. Sometimes we call it sexual desire disorder. Basically, the definition is kind of complex because what are we talking about? Well, one is low level of sexual interest resulting in a failure to initiate or respond to sexual intimacy. It's also defined as persistent or recurring lack of desire or an absence of sexual fantasies. So if you don't have a partner, you might not be aware that you have inhibited sexual desire, but if you realize, wait, I never even fantasize about sex, I don't think about what it would be like once I do become sexually active, it could be a sign. It might be what we call primary hypoactive sexual desire, where you've never in your life really felt that much sexual desire. You've never really fantasized. You've never really been that interested. Or it could be secondary, where you used to be interested in sex, but sort of somehow along the way, you just aren't anymore. So depending on which kind you have, we might come up with a different, sort of diagnosis about why. What causes it? Well, psychologically, again, depression and anxiety can interfere with sexual functioning at all levels. And one of the symptoms of depression is a lack of sexual interest. It's not a required symptom for depression, and it's one of just many that could be a symptom that a person might have and be diagnosed with depression, but it's a really common symptom. Relationship problems can make you not even think about wanting to have sex with that person, but of course, that doesn't necessarily make you not interested in sex at all. So if you, I've had it with my partner, and I'm just really not even remotely interested in having sex with them, but you might still fantasize. So if you're not fantasizing and you're sort of mad at your partner, it might be really hypoactive sexual desire at both, that's causing both things. Prior sexual abuse can make a person want to just basically not be a sexual person at all. And so they don't think about it. They don't want to think about it. It only brings back bad memories. It could be that they've internalized cultural and religious taboos so fully that they don't even want to apply sexual behaviors when it's appropriate, like when they are fulfilling the cultural demand of being married before sex or something like that. They might be worried about getting pregnant, and so they just try and put sex out of their mind. They might be under too much stress to think about having sex. So a lot of these things underlie a lot of the disorders we've been talking about. But a lot of modern cases of hypoactive sexual desire in people who are single have been being traced back to an ultimate fear of rejection. That if they try and put the moves on somebody or try and express that they are sexually interested in someone, that they might get rejected and they can't bear that. And that's kind of a newer common cause of this disorder. Some medical conditions can cause us not to be interested in sex. Not having proper hormone balances, especially testosterone for both sexes. You need at least a little tiny bit of testosterone or you won't be interested in sex. Certain medications can cause a lack of sexual desire. You know, I wanted to mention with regard to the low hormone levels and things like that, I have frequently heard people I have more than once had students say to me, or I've seen on TV people say about themselves that I'm just not I'm just not interested in sex. I'm just asexual. I'm just not a sexual person. One of the things you'll notice on this list is that none of the explanations for hypoactive sexual desire, lack of sexual desire, none of these are because you aren't a sexual person. You were not born to have sex. In psychology and psychological treatment, one of the hallmarks of adulthood, of passing through puberty and having a healthy functioning body, is that you're interested in having sex. So a person who's not interested in having sex is generally considered to have a symptom of something. And a person who's learned to live with it or has come to be comfortable with it, that doesn't mean that that's a healthy way to function. It just means that they've learned to cope with it. There are causes of inhibited sexual desire that maybe are uncomfortable, but are ultimately treatable. And so let's talk about the treatments. Again, familiarization with the body. A lot of times people who have inhibited sexual desire are just inhibited in general about their bodies and are uncomfortable exploring their bodies and enjoying their bodies and things like that. So, guided masturbation, learning with a partner to be interested in just enjoying the sensations is a huge step. And if both partners are devoted to, I want to enjoy these sensations with you, I am not focused just on having coitus or just having oral sex, or I don't have like a goal. I just want to enjoy touching you and enjoying you and breathing you in and stuff like that. It can have huge impact on the responsivity of their partner. And then of course couples therapy. And then biologically, guided masturbation, Kegel exercises again, lubricant again, because a lot of times when people are not interested in sex, it's because it was painful in the past or something like that. So a lot of times there are just really simple treatments that can make a lot of this stuff go away and a person can return to normal, healthy sexual functioning. Okay. Dyspareunia. I don't know. It's called painful sex. Painful intercourse is how I say it. It can hurt for either partner, and there are different kinds. It could be that it only hurts when you're penetrating. We call that entry painful intercourse. It could be that it hurts every time anything penetrates the vagina, even a tampon. If it hurts even when you're inserting a tampon. It could be that it used to never hurt, but now having sex hurts. It could be that it hurts somewhere in your pelvic region during thrusting. It could be a burning pain in your actual genitals. It could be higher up in your body. It could be an aching pain in your genitals or higher up in your body. It could be a throbbing pain that could last hours after intercourse. So there are a lot of different kinds of variations of what we mean by painful intercourse. What causes them? I'm getting redundant on my list of psychological stuff, aren't I? Right? Just say the word IBID means same thing as before. So, right, IBID, same thing, IBID. Medical conditions. This starts to get a little bit more exciting. It could be for women, if they have pain during thrusting, it might be because their uterus is tipped. On the left-hand side, you see the typical orientation of the uterus. And you notice that the vagina points back towards the spine, and then the uterus is tilted forward towards the abdomen. So that with thrusting in the vagina, that usually is going to sort of move past the uterus, especially when tenting has occurred and the uterus is lifted up. Whereas if you have a tipped uterus in the right panel, you could see that thrusting would cause the uterus to be pushed up into the intestines. And that can cause significant pain as you're, activating different sense receptors in the intestines. So that's one medical condition that can cause pain. Another medical condition that can cause pain is bacterial vaginosis. If a woman has a bacterial infection in her vagina, it can make the vaginal walls actually swell, and that can cause pain. Urinary tract infections can cause burning during penetration or any kind of touching of the areas around the urethra. Pressure during coitus on the bladder can cause pain. So, I mean, there are a lot of things that can cause, that are treatable and simple things. A lot of them are infections. Sexually transmitted infections can cause pain during penetration and during thrusting. I mean, there are a lot of things that can cause pain. Insufficient lubrication can cause pain for both partners. You can get friction and you can actually get like rub marks on your genitals. Trauma to the genitals can cause pain during sex. Different skin conditions like rashes and eczema and things like that can cause pain. And then, congenital abnormalities. A tipped uterus is one example of that. A man who was born with a urethra that comes out the side of the penis and then it got repaired, so it's coming out the tip. Sometimes we'll still experience pain during sexual activity. So, I mean, there are a lot of things that can cause it. So how do we treat it? Okay, IBID. And then biologically, IBID. So same things. So we have sort of like a limited palette of things that we can treat you with, but we also have a limited palette of things that cause a lot of these things. So of course, also, by the way, I forgot to list under biological, treatment of the infections can take away the pain. So I should put that on my list too, but I forgot. All right, so those are all of our sexual dysfunctions and disorders that can affect sexual functioning. So hopefully that was a good comprehensive list, and hopefully you didn't diagnose yourself during this process. All right, see you in Chapter 8.